Hi, Jill. My name is McKenzie. I'm going
Hi.
to be your counselor for the day, okay?
Yep.
All right. So, before we start this session, I just want to go over a couple things with you, which is our confidentiality. With that, everything within this session is going to be confidential between you and I. No one else outside, your parents, nobody's going to know about it, okay?
Sure.
All right. So, with that also being said, if you are planning to do harm to yourself or to any other people within, normal life, I do have to report that to the appropriate authorities.
Okay.
So anything you say along those lines, I will have to report.
Okay.
Do you understand that?
Yep.
Okay. Anything within this session, if you feel uncomfortable or you are feeling as though you don't want to answer any of the questions, just say I don't feel comfortable talking about it, and I will not push you any further on that subject, okay?
Sure.
All right. So, also, this session is not going to obviously make you feel 100% better. This is just simply for me to kind of understand what's going on in your life. So these questions that I'm going to ask you are going to be basic questions.
Yep.
And I'd like you to elaborate and explain to me as much as you feel comfortable explaining, okay?
Alright.
Alright, so what brings you in today?
I was told to come here.
Okay. And do you know why you were told to come here?
Nope.
Okay. So why you were told to come here is because there are people who are concerned within your life that have seen you attempt suicide, and your behaviors are wanting people to get you checked out, pretty much, just to make sure that everything's okay within your life.
Everything's good.
All right. So if everything's good, then all these questions should be super easy for you to answer, okay? All right, so let's talk about your family. Let's lighten things up a little bit, okay?
Yep.
So, brothers and sisters?
Yep.
How many do you have?
I have 2 brothers, a sister, and 2 dogs.
Okay. Do you consider your dogs your family?
Yes.
All right. What are their names?
Jack and Diesel.
Jack and Diesel. Okay. What kind of dogs are they?
Boxers.
Boxers. Okay.
Yep.
I love boxers. I have one myself.
That's cool.
Brothers and sisters. Older, younger?
I have one older brother, the rest are younger.
Okay. So you're kind of like the middle child?
Sort of.
All right. So your parents, you haven't talked about them yet.
Yep, I don't like them.
Okay. Why don't you like them?
Because they're always trying to tell me what to do, and they're, like, just not good parents.
All right. Why do you feel that or what actions that your parents are currently doing makes you think that they're not good parents?
Mom's a crack addict.
Okay.
Yeah.
And what about dad?
My dad goes to the bar every night. Super big alcoholic.
Okay.
All the time.
So do you currently live with them, I'm guessing?
Nope.
No? Where do you currently reside?
I live with one of my friends.
All right. What's your friend's name?
Joe.
Same name as you?
Same name as me.
Okay. Is he your best friend?
Yeah, he's pretty cool.
All right. Is he the same age as you?
No, he's 22.
22. Okay.
Yeah.
Do you guys live with him and his parents, or is it just you two?
It's him and my girlfriend and me.
Okay. Girlfriends?
Yeah.
What's her name?
Anna.
Anna?
Yeah.
Okay, how old is she?
She's 22.
Alright. So are you and Anna, how long have you been together?
About 5-6 months.
Okay. Everything's going good?
Yep.
Yeah, that's good. So let's talk about this issue that you had at school recently.
What issue was that?
I'm sorry, what was that?
What issue was that?
The one that I've heard about is you were at school and you made a sexual advance to a female student.
It didn't happen.
It didn't happen.
Nope.
Okay. Can you please explain to me why others are thinking that this happened?
I'm getting blamed for something that wasn't my fault.
Okay.
I have other students around me, friends, stuff like that. They were all watching, and they don't know what happened. They said they didn't see anything bad at all. And the student that accused me wrongfully, I might add, and the teacher didn't even take into consideration what anybody else had seen. He just went and reported it, and nobody cared.
Okay.
My side story of what actually happened.
So why don't you tell me your side of the story? What happened that day to have others feel like something was going on?
I just went up to her and she was just wanted to say hi. I said what's up, and then like she thought I don't even know what she was thinking. She just blamed me because I sat down next to her and she thought I was getting all up on her, and it was
invading her personal space.
Which was stupid because I was like 2 feet away from her.
Okay, so what I'm hearing is that this could have been a misunderstanding, and that have you talked with the teacher who made this?
No.
Okay. What I would suggest is that you possibly talk with the teacher and see, where they're coming from, and see what happened. Because I know right now you're not able to eat lunch with the other students, and I'm sure you probably want to eat lunch with your friends.
It would be nice to eat in the building, yes.
Okay, so what you can do is set it up, and you can talk to the teacher and kind of just see where they're coming from, and they can see where you're coming from on this situation.
Sure.
Okay. So with that being said, I know that you're on a few medications currently. How are you feeling on those?
I mean, I don't even know. They just I've been on medications for so long, I don't even know.
Okay.
What they're
What they're for?
Yeah.
Okay. Any side effects, headaches, anything along those lines?
Like I said, I don't even know.
You don't notice it?
I don't even know how I'm supposed to feel.
Okay.
People have been telling me how long, all the time, how I'm supposed to feel, and how I should feel differently. And
Okay. What I'll do is I'll write it down, and I'll tell Dr. Hackle, because I'm going to forward this information on to him. So when you go and see him, I'll let him know that you told me that the pills you're on aren't really doing anything for you. And then maybe he can help switch up what pills you take to maybe help you out a little bit. Okay?
What do I need help?
I can't prescribe medication. I'm just a counselor. So you'll have to bring that up with Dr. Hackle, because I'm not completely sure why you were put on the medication in the first place.
Okay.
Okay?
Yeah.
So let's go back to this issue at the hospital. You were recently admitted to the hospital due to a possible suicide attempt. Is that correct?
That wasn't even right, no.
Okay, can you explain to me what happened?
I was just trying to get off. Like, my girlfriend told me this thing you could do where you could, like, choke yourself out, and it made it, like, awesome. So I tried it, and I guess it didn't work.
Okay.
Yeah.
Was your girlfriend and your friend Joe both at the house at this time?
No,
Okay, it was just you and your girlfriend?
it was just me.
It was just you?
Yeah.
Okay. So, from what I heard about the incident, your girlfriend came in to find you on the ground,
Found me.
and you were unconscious.
Yeah, I guess.
So, and what it looked like to the people that were outside not understanding was that you had attempted suicide. Can you kind of see where they're coming from on that?
I guess, yeah.
Okay, do you have any depression type thoughts? Would you know? So
No.
you don't ever think about hurting yourself or others?
Nope.
Okay. Well, that's a good start. That mean it is normal as a teenager with all the hormones and stuff going on to feel sad or angry or anything along those lines.
Sure.
Okay. So what I'm pretty much hearing throughout this is that you have a lot of things going on within your life. Some good, some bad. You have your girlfriend and your friend Joe, who have kind of helped you out through your tough times with your parents and your family. And I've heard the bad of misunderstandings, possibly.
Yep.
And you kind of being misunderstood in some instances.
Yeah.
Is that true?
Yeah, that's about right.
All right. So what I'd like to do is I'd like to schedule another session with you if you would like, to kind of see how things are going within the next couple weeks after you have seen Dr. Hackle and everything. Would that be something that you're willing to do?
Yep.
Okay. So what I'll do is if you can stop at the front desk on the way out and just make another appointment for, let's say, 3 weeks from now after you see Dr. Hackle and everything.
I'm not supposed to see Dr. Hackle for a month.
Yeah, correct.
Yeah.
So do you want to wait till after then?
Yeah.
Okay. So let's say after your visit, just come by the office, make the appointment, or you can call. I don't know if you have a phone.
No, I don't have a phone.
Okay. So just stop by the office and make an appointment with me, and we'll kind of regroup after that. How does that sound?
Sure.
All right. Well, it was really nice meeting you, Joe, and I will see you again in a few weeks.
All right. Thank you.
All right. You're welcome. Have a good day.
Yeah.